Today I want to talk to you about preventing, reversing 3 commonly overlooked causes of heart disease and why you would get it. There's a shocking fact that if you look back, 120 years or so, you realize that heart disease was practically unheard of back then. What's changed? Well, for starters, there's the work of Broda Barnes, MD, who also had a PhD in biochemistry. What he did is he went to the country Czechoslovakia and he reviewed autopsy records going back 250 years. The reason he chose Czechoslovakia was state law mandates that if you die in that country, you must receive the mandatory autopsy. Arguably, because of this practice, they have the truest cause of death of anywhere in the world. And what he noticed was, more than 120 years ago, it's well known that half of all children born succumb to infection. They die prematurely. And he noticed through meticulous review of these autopsies that it correlated with them having a lousy thyroid gland. And so add in the miraculous, remarkable progress we've made over the last 120 or so years about increasingly sophisticated and prevalent immunization, pasteurization, antibiotics, sanitation. You begin to see a weakening elk situation where people that would have succumbed to infection and not made it into adulthood, not lived long enough to reproduce with perhaps another weakened elk, are now living. We have 5 or 6 generations of people that would not have made it living. However, what's not commonly being appreciated as a consequence of that practice is that secondary diseases are cropping up that didn't exist. And it turns out not having a good thyroid gland, you age at an accelerated rate, and one of the ways you can age at an accelerated rate is your arteries, making you vulnerable to heart attacks and stroke. So a pillar of your longevity is thyroid gland performance. Now, you need to realize that the standard of medical care in the conventional setting says that unless you fall below the bottom 2.5 percentile of a weakened elk population, they call that normal. You're normal if you walk through life at 2.6%. The way they specifically teach me to think about it is as long as you're within 2 standard deviations of the mean, you're normal. Well, with that backdrop in mind, maybe that's not in your best interest. Maybe it would be in your best interest if heart disease runs in your family. You enjoy a little more thyroid, not enough to suppress your own thyroid gland, but enough to put you a little bit higher into the normal. And that seems to be what Dr. Broda Barnes was onto years ago. It seems like it may have a role in helping us lower the consequences of weakened elk living long enough to develop the secondary diseases for which heart disease is one of them. The next commonly overlooked cause is there's a war going on inside you. Nobody told you about the war? Well, the war involves opposing steroid forces. On one hand, we have the anabolic steroid forces. On the other opposing end, we have the catabolic steroid forces. Well, it turns out who wins eventually shows up in your risk of acquiring heart disease. And we call this metabolic syndrome. Now, without my colleagues realizing it, because they don't do 24-hour urine, they might not see that metabolic syndrome has at its roots an overly active adrenal gland, which is great if you're going to go into combat or you're running from a saber-toothed tiger or you need to survive some other blood loss trauma. But today's world is mostly first world problems. It's not combat problems. So that means your sugar, if you inherit this trait, you're making sugar without even eating sugar, and insulin needs to secrete to remedy the problem. This happens countless times throughout your waking experience. And the root of the problem goes unnoticed. It's the overactive adrenals, not as overactive as Cushing's disease or Cushing syndrome, but moving in that direction. The metabolites of cortisol tell the direction. Recall we described a war between the catabolic steroids and the anabolic steroids. Well, what happens as you approach middle age is the anabolic steroids, the steroid forces that are in your body to repair your body, regenerate your body, and keep your blood vessels in good repair, they oftentimes sacrifice their production levels to maintain the catabolic steroids, the part of your steroid forces that consume body structure for surviving blood loss events that never occur in the first world, really. It's important to see what's going on, and you would benefit from a well-run 24-hour urine hormonal inquiry. Now, the third factor is really quite common, and it involves the fact that your immune system is injuring your arteries in a low-grade way. In fact, this is exemplified by the fact that less and less heart disease being found to be originating from strict cholesterol parameters per se. In fact, more than half of all heart disease victims have a so-called normal cholesterol. Well, what in the world would that be from? Inflammation. Where would the inflammation be coming from? Your immune system. Now, what's the telltale sign of your immune system being involved? Your calcium score. Well, why would that be, doctor? Well, most people don't walk into radiation beams, but if you did, you would calcify. Now, why is that? Well, your cells need to generate a voltage, and radiation beams are one of the reasons you calcify, because the voltage gets compromised and calcium penetrates, much like the force field in the Star Trek Enterprise is compromised, and in goes calcium to pummel your cells, and it reacts with intracellular contents irreversibly. And in fact, if you doubt this fact, consider that many wealthy patients go and get a calcium score from a CT scan. It correlates nicely with this process. What's not being comprehended, however, is where is the inflammation coming from most of the time? It's coming from your immune system. Again, my colleagues won't agree with this, but they do check the activity of your immune system. It's called an HSCRP, and that correlates quite nicely with whether or not you are suffering from this problem. And if you are committed, and you stay committed, and you stay focused, and you approach 100% compliance, your CRP will come down naturally. Why? Because you're not eating the food that's characteristic to you, doesn't agree with you, that is shortening your life because it's promoting inflammation somewhere within your anatomy. And one of the places many people sustain harm is the inside of their arteries, their coronary arteries, their cerebral arteries. And so if you're motivated, I can help you. You can do the 24-hour hormonal inquiry test and see what your war of the steroids is doing in an appropriate scientific way. And you could also do a food allergy test, checking you for 95 different foods. And by the way, we're checking the delayed arm of your immune system, by definition 2 to 72 hours after exposure, because that's what correlates with the HSCRP that the cardiologist is checking. So now we've reviewed 3 commonly overlooked causes.